Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is multiple choice questions in microbiology. 1. Pyrexia of unknown origin, PUO, refers to A. High fever with a known cause. B. Persistent fever without an apparent cause for more than 3 weeks. C. Fever that lasts for less than a week. Answer: B. Explanation: PUO is defined as a fever of above 38.3 degrees Celsius that persists for more than 3 weeks with no obvious diagnosis despite thorough medical evaluation. 2. Which of the following is not a common cause of PUO? A. Infection. B. Inflammatory disorders. C. Endocrine disorders. D. Psychiatric disorders. Answer: D. Explanation: although psychiatric disorders can cause fever, they are not a common cause of PUO. 3. A patient with PUO is most likely to present with A. Headache. B. Fatigue and malaise. C. Joint pain and stiffness. D. All of the above. Answer: D. Explanation: PUO is associated with a wide range of nonspecific symptoms, including headache, fatigue, malaise, joint pain, and stiffness. 4. Which of the following is not a common laboratory finding in PUO? A. Elevated erythrocyte sedimentation rate, ESR. B. Leukocytosis. C. Elevated serum creatinine levels. D. Hypergammaglobulinemia. Answer: C. Explanation: elevated serum creatinine levels are not a common finding in PUO. 5. The gold standard for the diagnosis of PUO is A. Imaging studies. B. Blood culture. C. Biopsy. D. Polymerase chain reaction, PCR. Answer: C. Explanation: a biopsy is considered the gold standard for the diagnosis of PUO, as it allows for direct visualization and analysis of tissue. 6. Treatment of PUO involves A. Symptomatic management only. B. Empirical antibiotics. C. Targeted therapy based on the underlying cause. D. All of the above. Answer: C. Explanation: treatment of PUO involves targeted therapy based on the underlying cause, once identified. 7. Enteric fever is a type of A. Food poisoning. B. Urinary tract infection. C. Malaria. D. Typhoid fever. Answer: D. Explanation: enteric fever is caused by Salmonella typhi or Salmonella paratyphi A, B, and C, commonly known as typhoid and paratyphoid fever. 8. The most common mode of transmission of typhoid fever is A. Sexual contact. B. Consumption of contaminated food and water. C. Inhalation of respiratory droplets. D. Skin-to-skin contact. Answer: B. Explanation: typhoid fever is transmitted via the fecal-oral route through consumption of contaminated food and water. 9. The incubation period for typhoid fever is A. 12 hours to 3 days. B. 3 to 7 days. Circa 7 to 14 days. D. 14 to 21 days. Answer: C. Explanation: the incubation period for typhoid fever is usually 7 to 14 days. 10. The clinical manifestation of typhoid fever includes A. High-grade fever. B. Abdominal pain and distension. C. Diarrhea. D. All of the above. Answer: D. Explanation: the classic triad of symptoms in typhoid fever are high-grade fever, abdominal pain and distension, and constipation or diarrhea. 11. The diagnosis of typhoid fever is confirmed by A. Blood culture, B. Stool culture, C. Serological testing, D. All of the above. Answer: D. Explanation: typhoid fever can be diagnosed through blood, stool, and serological testing. 12. Antibiotic therapy for typhoid fever includes A. Penicillin, B. Erythromycin, C. Ceftriaxone, D. All of the above. Answer: C. Explanation: third-generation cephalosporins such as ceftriaxone are the first-line therapy for typhoid fever. 13. The duration of antibiotic therapy for typhoid fever is A. 3 to 5 days, B. 7 to 10 days, circa 14 to 21 days, D. 28 to 30 days. Answer: C. Explanation: antibiotic therapy for typhoid fever usually lasts for 14 to 21 days. 14. Oral rehydration therapy is an important component of the management of typhoid fever because A. It prevents dehydration due to diarrhea, B. It reduces the severity of fever, C. It increases the uptake of antibiotics, D. All of the above. Answer: A. Explanation: oral rehydration therapy is an important component of the management of typhoid fever as it prevents dehydration due to diarrhea. 15. The dose of ceftriaxone for the treatment of typhoid fever in adults is A. 250 mg twice daily, B. 500 mg once daily, circa 1 g once daily, D. 2 grams once daily. Answer: D. Explanation: the recommended dose of ceftriaxone for the treatment of typhoid fever in adults is 2 grams once daily. 16. The dose of ceftriaxone for the treatment of typhoid fever in children is A. 50 mg per kilogram per day in 2 divided doses, B. 100 mg per kilogram per day in 2 divided doses, circa 200 mg per kilogram per day in 2 divided doses, D. 400 mg per kilogram per day in 2 divided doses. Answer: B. Explanation: the recommended dose of ceftriaxone for the treatment of typhoid fever in children is 100 mg per kilogram per day in 2 divided doses. 17. Monoacyl trimannose dominates in the cell wall of Salmonella typhi, Paratyphia, Paratyphi B and Paratyphic, which makes it a target of serological testing known as A. Weedel test, B. Coombs test, C. Leishman stain, D. Gram stain. Answer: A. Explanation: the Weedel test is a serological test for detecting antibodies specific to the antigens of Salmonella typhi and Paratyphi. 18. The treatment of enteric fever should be started at A. Symptom onset, B. Diagnosis, C. After the initiation of supportive care, D. None of the above. Answer: B. Explanation: the treatment of enteric fever should be started as soon as the diagnosis is confirmed. 19. One of the important complications of enteric fever is A. Hepatic failure, B. Pulmonary fibrosis, C. Renal failure, D. All of the above. Answer: A. Explanation: hepatic failure is a common and potentially fatal complication of enteric fever. 20. The goal of treatment in enteric fever is A. To prevent complications. B. To eradicate the bacteria. C. To suppress the symptoms. D. All of the above. Answer: D. Explanation: the goal of treatment in enteric fever is to prevent complications, eradicate the bacteria, and suppress symptoms. 21. Which of the following is not recommended for the prevention of enteric fever? A. Good sanitation and hygiene practices. B. Vaccination. C. Antibiotic prophylaxis. D. Avoiding contaminated food and water. Answer: C. Explanation: antibiotic prophylaxis is not recommended for the prevention of enteric fever, as it can lead to the development of antibiotic-resistant strains.